Well, good morning. So, what we're going to look at today is palliative care. So, we're going to go through some of the principles of palliative care and what it means for you. So, the first thing we'll look at is your learning outcomes, and you need to be able to understand the scope and key principles of palliative care, understand the key concepts of te ara whakapiri in the palliative care setting. We'll go through that and I'll explain to you what it is. Understand the concepts of holistic patient centered care as it's applied to palliative and end of life care. So, to start off with, what is palliative care? Well, it's caring for a person of any age who has a life limiting illness. It involves supporting and helping the person to live as comfortably and fully as possible. So that means that anyone that has an illness that is going to shorten their life, um, they are given palliative care. Now, we'll go through the palliative care continuum shortly, and I'll show you what it is. So, a life limiting illness is one that cannot be cured and may at some time result in the person dying. So, it doesn't matter whether they're going to be years away, months away, weeks a day away, or days away, they are entitled to palliative care to help them through those last years, months, weeks, or days of their life. It involves providing assistance at all stages of the life limiting illness. So, right from diagnosis to death, palliative care can be implemented. Usually, we try and get people involved right at the beginning, at the diagnosis stage, so that there is a consistency in care. So, it's an approach that improves the quality of life of patients and their families facing the problems associated with a life threatening illness. It doesn't matter what the life threatening illness is. Most people think of palliative care as being for cancer, whereas it's for any life limiting illness. And it's through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychological, and spiritual. So that's where the holistic stuff comes in. Um, so you're not only looking after the physical well-being of the patient, you're also looking after their psychological and spiritual needs. So you're looking after their mental health as well as their physical health. Um, and in palliative care, we use te whare tapa whā. And when we use te whare tapa whā, um, that comes into our impeccable assessment. So it's not just the first assessment you're looking at, it's continuation of assessment and continuing to assess your patient's needs and what's going on for them. Because someone who has a life limiting illness, things change for them from day to day, sometimes from hour to hour, depending on how close they are to death. So, the general principles of palliative care. So, it affirms life and regards dying as a normal process. So, dying is a normal process. It's inevitable for all of us. It neither hastens nor postpones death. So, you're not trying to put off the death by any medical heroics, but you're not trying to speed it up either. It provides relief from pain and other distressing symptoms. Pain is usually the biggest one for people in palliative care, and it's been found that if you can reduce a person's pain, then you can also better look after their other needs, like their psychological health and their spiritual health and their family and whānau health as well. And there are a lot of other distressing symptoms that go along with palliative care, especially towards the end of someone's life. It integrates psychological and spiritual aspects of care. Again, this is about holistic care and the care that you can give to your patients in a holistic way. So, if you can look after one aspect of their care, say a person is in pain, it'll affect their psychological well-being and it'll affect their spiritual well-being. So if you deal with the pain, you can then better deal with the psychological and spiritual. Offers a support system to help patients live as actively as possible until death. This is about keeping your patients as independent as possible until it is no longer possible to keep them independent. Letting them do things for themselves, not doing everything for them all the time. Offers a support system to help patients' families cope during the patient's illness and in their own. So sometimes you'll find that if you look after the family as well as the patient is more likely to have what's classed as a good death. And the family will be happier around what has happened for the patient. So it's about putting support systems in place for them, things like grief counselling and getting social workers involved and letting the patients do things, letting the patients' families do things for the patient. So this is our continuum of care. Um, Palliative care is a stage of illness when active treatment of the conditions is replaced by focusing on maintaining quality of life through symptom management, then progressing to ensure the quality of death and support of the bereaved family. Okay, so down here you've got you've got the prevention. Okay, so you've got diagnosis in here. So, and this is the illness, the continuum of the illness across the top here, and this is what happens after death. Okay, so curative care can happen anywhere in here, all right, but it's still palliative. You can still get palliative care in here, okay, and you've got symptom management in here as well. So, towards the end, you've got what's in New Zealand what's called hospice care. Okay, and you've got in here life closure, which is where the person is getting close to death, and the more they're getting close to death, the more you're counting on symptom management and not curative and life prolonging management. As you can see, the green bit is getting smaller and smaller, and the yellow bit is getting bigger and bigger. So you're more concentrating on symptom management. And then you've got the end of life or the dying phase, the active dying phase, okay? And you are still really concentrating on symptom management in the dying phase, and there is no curative or life prolonging care in the dying phase. And then after the person has passed, you've then got the bereavement phase for the family, and all those involved in the person's life. And hospice is still involved in the bereavement phase. They don't suddenly disappear when the person has passed away. Right. So the focus of palliative and end of life care. Now, palliative care is over here, and end of life care is over here. And end of life care is usually where hospice step in. You've got palliative care over here, and you've got specialist palliative care medical professionals as well. So, palliative care focuses on the quality of life, so making sure that the person is living their best life while they are sick. And end of life care focuses on the quality of their death, so making sure they have a good death. Palliative care is more about symptom control, whereas end of life care is comprehensive comfort care, making sure the person is comfortable in all aspects of their life. Palliative care is not prognosis dependent. So, prognosis is how long the person's got to live. Okay, so it doesn't matter how long they've got to live, they can still have palliative care. As we said before, it could be years. End of life care, the prognosis is less than 6 months. So, for someone to be able to go into hospice care, they have to have a prognosis of less than 6 months. Sorry, the sun's shining in there. I'll just turn around a little bit. Um, so then where can they be cared for? Well, they can be in palliative care, they can be cared for at home, in assisted living facilities, nursing homes, or hospitals. You usually find that most palliative care patients either want to stay at home for as long as they possibly can, and then they can go into assisted living facilities or into a nursing home. So, end of life care can be at home, assisted living, nursing, home, hospital, or in a hospice facility. There are specialist hospice facilities throughout New Zealand, and you usually find that in most nursing homes or residential care homes, there are specialised or reserved hospice beds. Okay, care will be provided as long as needed and is dependent on the type of care needed. So palliative care for as long as possible or as long as needed for the person. And end of life care. Care will be provided as long as the patient meets the criteria of hospice and is expected to be less than 6 months. So, if someone's under hospice care, it means that they've got less than their prognosis is less than 6 months. Okay, and they've got to meet certain criteria as well. Principles of delivery of palliative care. Well, it's got to be person centered. The focus of palliative care is the person who is dying as well as their family. So it's all about what the person wants. Um, and it focuses on them and their beliefs, their culture, and it also focuses on what the family would like as well, in conjunction with the person. But the main thing for palliative care is that it is about the person who is dying. All dying people should be informed of their entitlement to palliative care and have access to quality health and support services appropriate to and consistent with their needs. So, you need to know that some people out there don't actually know that they're entitled to palliative care and that they're entitled to have specialist care within the New Zealand community, and it's got to be appropriate and consistent with their needs. So they may have special cultural needs or they may have special religious needs, and it's the service has to be appropriate to that. Now, we can't serve everybody um, as they would like in a roundabout sort of way, but you've got to try and make sure that the person is getting the care that they would like. It's got to be individualized. When someone's dying, not everyone dies the same. Not everyone goes through the same thing. There are certain things that, you know, become very commonplace when someone is going through the death and dying stage, but not everyone is the same. So, and in saying that, each person's uniqueness, culture, and autonomy should be respected, with all care based on their expressed needs and wishes. And we'll go through what you can do to help people express their needs and wishes going forward towards the end of their life. But it isn't a tick box exercise. a lot of people will want different things at different times, and the way they want things done will be different because everybody's different and unique. Palliative care affirms and encourages the quality of life for each individual, while active interventions like radiotherapy, chemotherapy, and surgery have a place in palliative care. It is often done to relieve symptoms and should not increase distress. So, what it says here is that even though someone is in palliative care or even end of life care, hospice care, that they can still have things like radiotherapy and chemotherapy and surgery to help relieve symptoms. Now, there is such a thing as um, palliative care chemotherapy, and chemotherapy has proven to be really, really good for things like pain management. It's not a cure, it's not meant to be used as a cure, but sometimes it actually works. There have been cases where people are in hospice care, they're given chemotherapy for symptom relief, and the chemotherapy has worked on their cancer, and the cancer ends up being cured. Not very often does that happen, but there have been cases of it. So these things are used as symptom relief only. Comprehensive care. The achievement of total care for the person requires both a multidisciplinary approach and continuity of care before, during, and after diagnosis of the terminal illness. Okay. So it's a multidisciplinary team effort when someone is dying. So you can have all sorts of people in there caring for this person. It's not just a doctor, a nurse, and healthcare assistants. You can have physiotherapists, occupational therapists, um, social workers, spiritual workers, all that sort of thing should be involved in the care as well. We do use end of life care physiotherapists that can help the person with symptom management and try and give them as independent a life as possible. Right, first activity. So, what you need to do is you need to read this scenario. So, Mrs. S, a 78-year-old who has received a terminal diagnosis of bowel cancer and was recently referred to palliative care services. Mrs. S lives with her 82-year-old husband who suffers from osteoarthritis. They live in their own home and wish to continue to do so for as long as possible. They have 4 adult children and an extended family who are supportive. You are the HCA visiting Mrs. S, and she asks you to explain the concept of palliative care. Now, I know it says working as groups, but you need to do this individually. So, using the scenario, develop a short role play. It only has to be 2 to 3 minutes long, in which the HCA explains the palliative care to Mrs. S and her husband to help them understand what it is and the general principles of this type of care. Then you need to, it says here, each group will present the short role play to the class. But what we actually need you to do is type out your short role play, and or you can video your short role play, and then you need to upload it to the Dropbox that's going to be in this section on Moodle. Okay, so a short scenario. You read the scenario and develop a short role play, 2 to 3 minutes long. Now you can either submit the written role play, or you can video or get a family member to record you doing the role play and upload that to Moodle. Okay, make sure you upload it in a YouTube format. All right, and we will carry on with this shortly.